Hello everyone. Today we are going to talk about premature ejaculation, PE. Most people experience sexual problems during a certain period of their lives, such as erection problems and premature ejaculation, which can greatly affect their happiness with a partner. Today's topic is about premature ejaculation. Do you have this problem, or do you know anyone close to you who has the same problem? Well, in this video, we'll explain to you everything related to this problem, its causes, how it can be treated and prevented. Our role today is to answer most of your questions regarding premature ejaculation. Today we have Dr. Pang, who is a leading doctor at Stantop Clinic. He is going to discuss with us everything about PE from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases.
안녕하세요.
Hello, Dr. Pang. Can you introduce yourself to us?
Hello. I am Bang Junho, Director of Stantop Urology Clinic.
It's very nice to meet you. So for our first question, what is premature ejaculation?
Premature ejaculation refers to ejaculation that is literally fast because it is difficult to control the ejaculation as well. In the past, it was said to be premature ejaculation if the ejaculation was made within 5 minutes after the general pistol movement began. But recently, it is said to be premature ejaculation if the dissatisfaction of one's partner occurs due to faster ejaculation.
So is this a pathology or a normal condition?
Just because the ejaculation is faster than the average level, it is not abnormal. Even if the ejaculation time is earlier than average, it cannot be said to be a pathological state if you and your partner are satisfied. However, if a quick situation causes dissatisfaction, sexual frustration and serious stress to you and your partner can be said to be a problem.
So what is the diagnosis and treatment of premature ejaculation?
Before explaining the diagnosis and treatment of premature ejaculation, I will explain the concept. According to the cause of premature ejaculation, 5 types are classified. The first is premature ejaculation due to a causative disease. The second is psychogenic premature ejaculation due to hypersensitivity of the sympathetic nerve. The third is irritable premature ejaculation due to the sensitivity of the glands and penis. And the fourth is weakness, which occurs simultaneously with erectile dysfunction and premature ejaculation due to poor ejaculation function. Lastly, premature ejaculation caused by not having too less sex is divided into 5 categories. There are many complex cases. There is no standardized treatment for premature ejaculation, and the treatment is performed in the following order when visiting the hospital. First, ask if the patient suffers from a disease that can cause premature ejaculation. If there is any medicine the patient takes, and then ask the patient whether erectile dysfunction is accompanied, and what is the sex cycle. Through this, among the causes mentioned earlier, it is identified whether premature ejaculation has a cause such as a weak premature ejaculation or a cetogenic premature ejaculation. Next, through a vibration angle test, a test that measures the degree of sensitivity of the glands and the penis is performed to differentiate whether it is an irritable or psychogenic premature fistula. When treating in the case of causative diseases, proceed in the direction of treating the cause. In the case of weak premature ejaculation, strengthens pelvic fascia, treats impotence, and injects testosterone hormones. Since pseudo-premature ejaculation is a disease caused by too little sex, it helps to periodically assesses. Most patients who visit the hospital have a lot of irritable premature ejaculation or psychogenic premature ejaculation. Therefore, these 2 treatments are usually performed, and in the case of psychogenic premature ejaculation, the treatment is focused on various drugs and medications that can promote parasympathetic nerves. In the case of irritable premature ejaculation, the problem is the sensitivity of the penis. So we focus on surgical treatments such as nerve block surgery, which is to reduce the sense of the glands and the penis. Neuroblocking surgery is usually what comes to mind when it comes to premature ejaculation surgery. However, there are various alternative methods, such as surgery to insert membranes to block the sensor that can act as cushions in the glands or penis torso, in addition to nerve block surgery. In addition to the various treatments mentioned so far, the treatment effect can be maximized by combining behavioral therapy that can do alone. There are several treatment methods such as stopping behavioral therapy and identifying the results.
So can prostatitis or STDs cause premature ejaculation?
Yes, also the cause. Urethritis and prostatitis can cause premature ejaculation. Most of the urethra and some of the prostatitis are caused by sexually transmitted bacteria. When the prostate is inflamed, the prostate and its surrounding tissues swell and grow hard, which presses the nerves related to the premature ejaculation, resulting in premature ejaculation. And the tension in the perineal muscles caused by prostatitis causes deterioration in ejaculation function. It leads to premature ejaculation because it prevents semen from erupting. Finally, pain during circumstances felt due to prostatitis or anxiety and tension that sexually transmitted bacteria can lead to premature birth.
So for our last question, are there any methods to prevent premature ejaculation?
There's no way to prevent all types of premature ejaculation. However, there is a way to prevent weak premature ejaculation. The Kegel movement is that. Through Kegel exercise, pelvic hypotenuse can be strengthened, since pelvic muscles play a role in sending blood to the penis and the tip of the glans penis. They can strengthen the erectile movement by strengthening the muscles. In addition, pelvic muscles are effective in premature ejaculation because semen cannot come out while tightening the commander, and also help improve orgasm because they play a role in pumping semen vigorously during ejaculation. Therefore, strengthening the pelvic muscle is helpful for premature ejaculation.
알겠습니다. That's it for today. Thank you so much, Dr. Pan.
Thank you.
Today we learned many things about premature ejaculation, and the doctor explained in details everything related to this common disorder and how it can be treated and prevented. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.